So welcome back, everyone. I hope you had a couple moments to care for yourselves and get something to drink or stretch. So I want to welcome you to the first session of our second day here. We're talking about evidence-based and culturally defined practices this morning. My name is Martha Staley. I'm part of the staff in Region 1, MHTTC, which is in New England. So I am just thrilled to be the moderator of this session this morning and to be in rich discussion with Jillian, Polly, and Rozlyn. And as a grieving person and as the parent of a grieving child, I'm so grateful for the work that our panelists and others are doing in schools to help and give us language and present ways of being to support children and families who are grieving. And I'm really struck by Candace's question about where does grief live in communities? And we are ever more aware of the fact that our schools have become containers for grief, both on the individual level and at the community and collective levels. So today we get to learn from our faculty who are contributing to the information and knowledge that we have about school and community-based grief counseling through equitable research design and implementation. And I'm excited to hear about the new practices that they're going to share that are so timely and so central for our populations of school mental health providers and the children and families that you all are serving. So just a couple of housekeeping items for those of you just joining us. We invite you to continue sharing ideas, resources, thoughts, ideas that resonate with you in the chat box throughout your experience with us. We're so grateful for all that you are sharing yesterday and today about your experiences. If you want to send something, if you'd like to share something with everyone, please just make sure that you've selected the all attendees and panelists button in the chat box. And note again that we welcome you to share what's resonating or ideas that are connected to our discussion. But as a reminder, we ask that you keep your chats and interactions respectful, compassionate, and generative, and relevant to the discussion that we're having today together. If you have specific comments to panelists, you can select just the panelists list in the chat box. We welcome all of your questions about the work of our faculty through the Q&A box, and you can directly chat tech help at any point today. This session will be recorded and will be on our event page 2 weeks from now, and you can access closed captioning by clicking the CC button below. We're also very grateful for our ASL interpreters this morning. You'll receive an email on how to access a certificate of attendance. And just as a reminder, you must attend at least half of today's event for around 2 hours. So on that note, I'm going to welcome our tech support to take the slides down so that we can meet our faculty. So let's meet our faculty. We're going to go alphabetically, starting with Jillian, then Polly, and then Rozlyn. So we invite each of you to share who are you, what brings you to your grief work, and what comes up for you when you hear our GSVLI theme of grief sensitivity, where we are now and where we can go with our practice. And you'll each have around 10 minutes. So Jillian, I'll turn it to you. Thank you.
So it's saying that I cannot share my screen. There's some security denial. So maybe someone can pull up my slides on your end.
Okay, Jillian, I'm just working on the permissions that you have. So let me double check those so that we can try you again. Okay. Apologies.
Yeah, no worries.
Okay, Jillian, will you try sharing your screen one more time, please?
I Yes, receive the same message.
Okay, great. I'll pull up your slides. Just one moment to get
Yeah,
there.
it's not allowing me to.
Okay, Jillian, just cue me when you would like them to be advanced, okay?
Okay, sounds good. All right, well, hello everyone. Thank you again for this invitation, just to share a little bit about me, a little bit about the work that I'm doing. And I'm so excited to be among many people who understand that grief is a journey and a process, and want to support ourselves and each other even more. So just my professional background, I'm a clinical assistant professor at the University of Denver for our school counseling graduate program. Clinical mental health, working with individuals of all ages is my background, but really have kind of honed into grief. I'll get into that into the next slide. I'm also a part-time therapist in the Denver area. I wish, you see that picture of the Denver area there. It's a beautiful city. It's quite chilly today, so I'm envious of all that are in warmer weather, but happy to serve the community where I live. Professionally, I'm involved in grief in many different ways, but without grief affecting me personally, I don't know where I would be professionally. And so this quote really resonated with me. I am a child griever, right? I had my first major loss of my mother when I was a kid, and that has propelled, everything that I do now, although I would not have known that when I was a teenager and after her sudden pass. And so I keep that in mind when working with children, adolescents, working with their families, working with communities, that there is a longing that we can have when we are grieving variety of losses, but particularly death-related losses, and how we can hold that special individuals with us for quite some time, right? For the remainder of our lives, quite possibly. You may transition to the next slide. So how I got into grief work, after I experienced several losses throughout my life, I would have never imagined that I wanted to research about it, engage in it professionally, talk to others about it as much as I do. But it's sometimes humorous where life will take you. Starting off even before, in my own training is where I got really exposed to a lot of community partners in the Orlando area. Advent Health Hospice Care, formerly called Hospice of the Comforter, where I completed my practicum and internship, right? Brand new to the field, very nervous, and did not know anything really about grief counseling, especially grief counseling with children and adolescents, but had the opportunity to be around so many individuals who are willing to be so vulnerable with me that I had no other choice but to keep engaging in grief counseling. Also spent some time with New Hope for Kids, which is one of many organizations around the country that is centered on supporting grieving children and families, and so was able to recognize my joy and my passion that I get from working with others, again, who are so vulnerable and so open for me about their losses, and for me to reflect on my own losses and grieving process. I think that where my work really landed with children and adolescents is just the fact that sometimes they can be overlooked. They can be forgotten as grievers. How they grieve can be so different than how adults expect others to grieve. And so I really wanted to keep my focus and research and just, compassion and empathy for our youngest grievers who are trying to navigate so much in addition to the losses that they have experienced throughout their lives. You can move on to the next slide. So as far as where I see us has come from, so much we learned about grief and loss and counseling in children and adolescents along the way to where I hope that we continue to progress and evolve in the future. I imagine I work with lots of kids and when I worked with adults, I think we are slowly really trying to reframe how we view grief. right? We wish that it can be something that is a problem that we can just implement this one solution and things will be okay, right? For ourselves, for the children and adolescents that we work with and engage with. But we know that that is far from the truth of how grief actually works. And for children and adolescents, that is no different. Right? For the whole school systems and settings, and everyone involved, that is no different than anyone else who is grieving. And so I see more and more of recognizing that grief is fluid, it's messy, it's complicated, it is evolving, it doesn't have an end date, it doesn't work in a clean, linear fashion, and it involves a lot more of us than maybe we want to admit initially. And so through that, and trusting this process of grief and how it can appear, it can reappear, how it can change one day and 1 minute from another, really trusting that process of not having expectations of how children, adolescents, how ourselves should be responding to grief is where I see us right now. And then really I would hope for, we continue to understand grief as a collective process. I see a lot of where I'm engaging with colleagues, others, everyone, we see grief as a universal experience. We all experience some type of loss, multiple losses throughout our lives. Again, kids are not exempt from that, but yet it still can feel really isolating. We can still feel that we can't share our grief and our losses with others, and especially for children and adolescents that may be developmentally, what they want is to fit in. They want to be liked. They want to be similar to other people. And having a loss, grieving can separate us, can make us feel like we're separated from others. So I hope that we can really have this collective support that we're starting and modeling and encouraging individuals from the very beginning, right? And not something that we have to learn afterwards. Oh, I do have a support system. Oh, I can reach out. There are people who are grieving like me, that we have conversations about grief, loss, death, bereavement, all the words you're thinking about from the very beginning with our youngest individuals, and we don't shy away from those conversations, so that even if they haven't experienced a loss yet, they can start to create empathy and have compassion for others who have, knowing that when that time comes and they experience their own loss, they don't feel like they have to handle that by themselves, but they are more likely to reach out for support. So I hope that's where we continue to go. I see that in many capacities, but I hope that we can continue to push that and encourage that for ourselves, and then onto those who are looking up to us at this moment. And that's a little bit about me.
Thank you so much, Jillian. Let's see, Polly.
Good afternoon, everyone. Let me try to see if I'm able to share my screen, but if not, I sent my slides. Okay, I'm able to. Just give me one moment. Okay, is everyone able to see that? Okay, excellent. Okay, good afternoon, everyone. My name is Polly Gibson, and I come to you from Southeastern Michigan. I'm a clinical associate professor and associate chair for diversity, equity, and inclusion, as well as the director of our trauma and grief clinic in the Department of Psychiatry here at Michigan Medicine. And I just want you to know that I'm very, delighted to be here. Yesterday, I was able to be more immersed into this virtual institute than I was this morning, unfortunately. But what really resonated with me is just this notion, like, this is really soul work. I was thinking last night how there's only one other conference that I've ever attended, and I attended annually prior to COVID, that really connected me with the experience that I had yesterday from being present in this space. And that was the American Association of Suicidology, or AAS. And it's obviously there's a connection here, because a lot of people who attend that conference, they're coming there with lived experience of survivorship. They're coming there with lived experience of suicide attempters. And they're coming there with lived experience of grief because their loved ones have died by suicide. And I really saw this connection yesterday with what came up for me from being in this space with you, and that the very first time I ever attended that conference. And it's just this notion around grief and how if you allow yourself to be vulnerable enough and to really let grief, teach you, and let grief even sometimes envelop who you are, that it's soulful work. And so I just wanted to say those remarks. So I'm also going to briefly try to address these questions. They're very big questions, right? So I think the first question that was asked is, who am I? Okay, that's a very, big existential question. So my best way of sharing with you who I am is just to bring to you a quote from Dr. Maya Angelou, which is a philosophy that I've taken on and kind of like my personal mission statement of how I'm hoping to live my life. And Dr. Angelou said, "My mission in life is not merely to survive, but to thrive, and to do so with some passion, some compassion, some humor, and some style." And for me, this is maybe I should say I'm becoming. I don't know that this is who I can say I am today, but aspects of this are certainly who I am, but I'm certainly becoming and arriving at her mission. And I definitely think she achieved her goal, and I hope that I'm able to as well. So the next question I was asked to address in my brief introduction is, what brings me to my grief work? Again, that's very, very big, because it's multi-layered. I mean, as many of you have stated, like you, I have lived experience of a significant personal, deep grief in the death of my mother. And we all, I think, yesterday people kind of shared that, and even before that happened to me in my life, I still was bearing witness of other people's grief. And I was primarily doing this in a clinical space. So I am a clinical psychologist. I didn't say that. So although I'm in a psychiatry department, I am a clinical psychologist by training. And I trained in Chicago. And I had an opportunity to bear witness to too many children and families who had experienced, in this case, the premature deaths of their loved ones. And really trying to grapple with that, because oftentimes they were coming into our clinic because they were, being suspended from school or expelled, or they were a behavioral problem, or, the list goes on. And I know that many of you in this space understand that. So I would say I initially came to grief work as a clinician, but as a clinician who saw that I needed to work at a different level, because these children were not being, their grief reactions were not being understood as grief. And one of the things that I struggle with, and I still struggle with this, is trying to help myself and others to see people's humanity. I think sometimes when people are experiencing grief reactions and maybe they don't look like us, or maybe there's something about them that feels unfamiliar, or there's a lack of knowing, that we forget that shared knowing and that shared humanity that we have. And I think that's how grief oftentimes gets, missed or not recognized for what it is, or it gets enveloped into so many other things that it's not. And so what I try to do now as the director of our trauma and grief clinic, I have the opportunity to train those who are coming up, and I'm working with psychiatry and psychology and social work trainees. And I try to make sure that, we are working in evidence-based practice. I know yesterday we talked about, being open to some new ideas. And I hope that we can be open to the idea that there are certain children and teens who do need clinical intervention because of their grief reactions. I know that I'm open to that idea because I myself experienced a clinical depression after my mother transitioned, and I needed the mental health field. So I hope that we can be open, not to pathologize. I absolutely agree. We don't want to pathologize people, but I hope that we can be open to understanding that there is a place at the table for clinicians and mental health providers to work with children and youth. I'm focusing on children and youth because that's the space that I occupy. And so I'm working with my trainees to be able to deliver evidence-based practice as it relates to understanding children and adolescents' grief, but also to see their humanity, to, even if they don't give voice to it and to their patients in their own vulnerability, to have that recognition of the griefs that they have experienced and how they wanted to be engaged. My last slide that I'm going to leave you with, the last question that I was asked is, you know, when I hear the theme for this year, which is grief sensitivity, where are we and where can we go with our practice? Again, other people gave voice to probably exactly what I'm about to say. I really do hope where we can go with our practice is making sure that whoever we have the opportunity to engage with, be it a child, a teen, an adult, a community, whoever it may be, that we do it in the spirit of seeing people and hearing people and valuing what they're teaching us. Because as I work in various communities, one of the things I'm sure we'll talk about a little bit more after we do our introductions is I'm recently closed out a project. I had the opportunity to work in a community in southeastern Michigan I had funding to do this, around this notion of building a trauma-informed school system. And what does that look like? And how can we do that? And I hope I'll get a chance to share a little bit more about that. But it also connected back to what I'm saying here is that at the core of the grief work, we do have to be skilled, but we also have to make sure that we're using those skills in a way that's validating and that's affirming and that is allowing us to come as someone who has something to teach, but someone who also has something to learn. So with that, I'm going to thank you for my brief introduction, and I look forward to sharing more about the different spaces that I occupy in this grief community that we're in. Thank you.
Thank you so much for that. Rozlyn, can you tell us about yourself?
Hi, yes, if Felicia, if you don't mind sharing my slides, that would be great. Thank you. Well, let me just begin by saying how humbled I feel to be here among so many wonderful scholars, great clinical practitioners, and really great thinkers and experts in this topic. I'm privileged to be able to share about my perspectives from a from my clinical practice. My name is Rosslyn Kwong, and I'm a licensed marriage and family therapist in California. Next slide, please. I'm with the Hathaway Center for Excellence and a research and training institute. And the Hathaway Center for Excellence is a program of Sycamores, which is a community behavioral health organization here in Los Angeles County. And the largest program is our school-based mental health program. Next slide, please. And my role is as the implementation specialist. I'm involved in all aspects of implementation of evidence-based practices, including the planning, training, strategizing, organizing, and evaluation of best practice. And in terms of my identity as a human being, first and foremost, I'm an aunt to a wonderful neurodivergent 13-year-old with whom I live and from whom I'm learning from every single day. I'm a 1.5 generation immigrant from Hong Kong. I'm a friend, a therapist, an EVP supervisor, a trainer, and the person that hopefully folks come to for support in implementing clinical practices. I'm also a student and a lifelong learner of human behaviors and experiences. And what brings me to the grief work? As almost all of my panelists and many of the grief experts and learners here today, I myself have experienced multiple losses in my life, including parental loss, loss as an immigrant, and also loss right now with what's going on in Hong Kong and many others losses. One of the most significant losses was the accidental death of a close friend when I was 16 in high school. And then I have another close friend from the same friend group 12 years later died by suicide outside of the cemetery where the first friend was buried. I share this not because my losses were necessarily unique, but because of how I personally experienced grief as a high school student, not knowing how to grieve and being told by well-meaning people from my family, my school, my faith community, how I'm supposed to grieve or not to grieve. And I also witnessed how the pain of traumatic grief is experienced and how it impacts us. I witnessed the impact of grief on the student community, and as I watched the pain of those very close to me while I delayed my grieving process for many years. And this really helped me see the importance of grief work. I also witnessed it in terms of my clinical work. And in my clinical work, I've also had the privilege to work with those grieving a death, a separation, and other losses in grief support groups, as well as in therapy. Working in foster care and then in community behavioral health, I had the opportunity to work with very young children and all the way to adults. And I witnessed the impact of grief experience on the way they see themselves, the way they build relationships and interact with other people, the way they manage the world at school, in their families, in their workplace, and as they try to live with the loss beyond the loss. And the top picture here just signifies how it may not always be very obvious from looking at a child that he's grieving. And when there's so much that may be going on that we don't see, and how his life may be impacted in many ways. As a supervisor and a trainer, in addition to getting requests for training and how to support someone on their grief journey, I also observe quite a lot of fear, or at least hesitation, in talking about grief and losses in parents and caregivers, school staff, social workers, others working in youth communities, counselors, and therapists. And I really began to want to understand more how this fear or hesitation is influencing the way that we can show up for those who are grieving. And I'm thinking, if I'm afraid of actually looking at the storm, how do I sit with someone as they watch the storm and try to make sense of that? And that's what the second picture in the slide signifies. The next slide, please. And where we're here now, and where do we go from here? And I believe that we have heard from so many grief experts yesterday and today about the multidimensional losses as experienced under COVID-related circumstances. I appreciate the fact that we're talking about grief sensitivity. And this theme to me highlights the need to build awareness and not necessarily only knowledge, as Dr. Gipson so nicely put. This is significant because while some of you may be able to walk away with some practical ideas about what to do to support a student who's grieving today, I'm hoping that we all walk away reflecting on how to be with someone who's grieving. And when working with staff about providing grief support, a lot of the times, the first thing I would notice is how there are many barriers standing in the way for us to provide grief support. And these barriers may include things like, I don't know what to say, or having our own internal judgment about how someone should grieve, or our own internal grief getting in the way. And I think that grief sensitivity is moving away from these self-perceived barriers to a sense of awareness about the reality of grief and loss, to have a willingness to listen, to self-reflect, and really maybe the caution to not assume that there's just one way to grieve, but to invite storytelling so that meaning making can happen. Now, one book that I was introduced to, it's called The Rabbit Listened by Dorfield. The reason why I'm really drawn to this book is from this story. It's very obvious what a person that is going through a loss really needs. What we see in this rabbit that was able to be there with the person and be able to listen is that once that is done, when we're able to be with that someone and listen, that's only then are we able to start talking about the loss. Only then are we then able to really experience all the emotions and feel all the emotions about the loss. And then also to start really remembering the loss and eventually to be able to envision our future as well without the loss. And so I just want to highlight that I appreciate the fact that we're talking about grief sensitivity. In terms of our practices, one of the things that's been very evident, as many of our speakers have talked about, is definitely the fact that that we, sorry. Now, one thing about the grief that's happening right now is definitely the evolving nature of the COVID pandemic. And the fact that this is evolving, in fact, it puts me in a place of more questions rather than answers. And one important aspect, which has been touched by so many during these sessions, is the intersection between grief and trauma response. And amongst the experts on this very panel, I feel like an elementary student talking about the topic of traumatic grief, and I really hope to hear more from my co-panelists. Another aspect of the involvement is the need for screening of trauma and loss, as well as assessment of traumatic and grief reactions. And as mentioned earlier, especially in youth, sometimes someone can walk around with no one even realizing that they are grieving a loss. And we also need to address what grief support can look like in clinical practice. How do we, as a clinical community, support students in moving through the essential tasks involved in the grieving process, as Warden proposed, without pathologizing grief? What does safety look like for the storytelling and meaning-making process? Can we tap into the protective factors that support someone in their grieving process? And can we challenge ourselves to think about how to involve family members in the support process? How do we support the emergence of intrapersonal variables such as resilience that are found to be strong determinant in how youth adjust to adversities? How do we encourage a more multidisciplinary approach in coordinating grief support? And what would that look like? Another important part that's evolving is the training and implementation support for those supporting individuals on their grief journey. Again, grateful for my co-panelists who are dedicated in providing the training for the next generation of service providers, building their awareness and grief sensitivity, their skills, as well as how to be with the person. There's so much to be learned from them about what the training may look like. And in terms of implementation support, what do service providers who are offering grief support need from us in order to sustain what they're doing? What are we noticing about those who are providing grief support? And what are the most important supervision elements and practices in supporting those who are providing grief support? I'm just very honored to be here with you thinking through some of these questions today. Thank you.
Thank you so much, Rozlyn, and thank you so much to all three of you for your thoughts to start us out on this session. I'm struck by so many of the common threads that were interweaving in your introductions to yourselves. First, how you all mentioned your own personal examples and experiences of grief, particularly as children. And talking about that parallel process with doing grief work as well at the same time, and that doing that work offers you a way to investigate and work within your own grief. So I'm struck by that, and I'm also struck by the Polly, you brought up how important it is to think of mental health professionals essentially as partners in healing from grief and traumatic loss, which is separate from pathologizing grief, right? But thinking about when we are considering school communities and all of the diverse experiences that children bring into school communities, how important it is to see our mental health clinicians as partners in that process and diving more deeply into that. So I'd love to dig a little bit deeper into some of the things that you all have shared so far this morning. And I would love to hear about what you're learning, what you're finding, what you want to share as it relates to school mental health practices concerning grief, or culturally responsive practices in mental health, school mental health communities. So that, I know that's a very broad question, but we'd love to hear what's on your mind and on your hearts concerning this work.
I'm happy to start us off. So I'll just share, you kind of said, what are you learning? And for the 3-year project that we embarked upon in that Southeast Michigan community, one of the things that I learned, and it allowed us to really kind of hone the project in this way, is we want to make sure that we remember those caregiving adults in the school system. That's very important. And so in the work that we were doing, I was in the school. This was, again, pre-COVID. We went to virtual for a while, but pre-COVID, I was in that school building 1 day a week. And I thought that I was going to be there doing some follow-up kind of coaching with the teachers around, we were doing a trauma-informed positive behavioral interventions and supports. And what I was hearing, and this is how I was saying, how we have to make sure we hear and we listen and we value, I was hearing the staff's own kind of secondary traumatic stress. And I was hearing their own really burnout, frankly. And I went back to our team, and what we decided was like, you know what, we need to make sure that we address these teachers, these staff, because they themselves are dealing with so much that they don't have as much to give as they want to give to their students. And that led us to one of the support programs that we did was Compassion Resilience Circles. And so we were able to invite the developers of that, and they have multiple toolkits, and we focused on their toolkit for school staff and also for their parents and guardians. And even though COVID moved us into the virtual world, we were able to continue these circles. And so I just want to offer that to say that we have to remember that within the school system, it's not just the children. And oftentimes we forget about the parents and the caregivers and the adults who are expected to educate our children and support our children, that they need these supports as well.
Thank you so much for sharing that compassion, resilience circles. And I think that, you mentioned something that Rozlyn brought up about the importance of including families in that work and thinking of this as a community process. And I know as somebody who was trained as a teacher, and a classroom teacher, there's no training in how to understand, acknowledge, or process grief with students, let alone as an educator. And I also appreciated you bringing up the point about the larger school staff, that the culture in school communities is educators and it's the school mental health staff, but there are also these other adults who can be supportive and compassionate, connected influences in the lives of children and families. So thank you for that. Jillian or Rozlyn, do you have any thoughts about what you're learning, what you want to share?
Yeah, a few things. A couple years ago, when I completed my dissertation and really got into the preparedness that counselors, whether in the schools, clinical mental health, rehabilitation counselors, how prepared they perceive they were to engage with grieving individuals. I noticed a common theme of just lack of training from their programs, but also if they were willing to reflect on their own loss and the grieving processes and journeys, then they were more likely to engage in those conversations with others. But if they weren't, then as soon as they heard, someone talk about it, a student bring it up, they would overlook it, try to divert the conversation because they didn't want their own stuff to come up. And that is, I saw that years ago. I see that now. I see that in research and articles that I've read even before I got into this professional work. Are we willing to embrace ourselves, knowing that we bring our whole selves into our interactions with everyone, but particularly in our professional spaces, especially with students, their families, colleagues, and so forth. And if we're not, then we can be doing a disservice, right? Especially to children and adolescents who maybe can't really pinpoint, what they're really feeling, what they're thinking, may not even know what grief means, right? And so we're not having those conversations with ourselves. We're definitely not going to be having it with the youth around us. And so I see that. And then also it's, okay, I'm ready to have these conversations. I'm ready to engage in grief counseling, grief work. But grief is so contextual and it's so cultural, right? And how one person responds to grief is not going to be like somebody else. And if we don't take the time to understand one's traditions, their rituals, religious, spiritual beliefs, and be ready to kind of have some of those harder conversations, especially with youth who maybe just are figuring those things out for themselves already. And then, we learn how to grieve from other people, right? So a lot of times what I've worked with younger kids, adults, okay, you went through this loss. How were the other people around you grieving, right? Well, they didn't talk about it, right? We took down all the pictures. We didn't mention anything about it. And so I thought it wasn't okay to talk about it, right? Or we celebrate this person often, right? We have conversations about it. I've seen people in my family cry. I attended, death-related rituals, right? Or I recognize the other losses that have come because of maybe one primary loss. And so that can also be an insight into, again, what's the cultural norms that we have, and that can make its way into the school systems. Working with and just collaborating with other school counselors and school-based mental health professionals, we're looking into this multi-tier systems of support, right? And so not every student needs the exact same service or intervention or conversation or engagement, but sometimes they do, right? And sometimes the broader school community does, right? And so how do we also not be reactionary to when there is a loss, but rather know that losses, death-related or not, will be happening to all students. And so as a school community, we're going to set that norm, we're going to set that culture. We're going to have, processes and procedures and things to address when things happen, but also we're going to just be here with each other. Like the other co-panelists have mentioned, of just not coming with the right answers, not coming with, let's go in and fix this, and here's what you're going to do, and here's what can work, but just tell me about your loss, right? A lot of times with any client, any student, any person just I'm talking to about their loss, especially if it's an individual that they have lost, tell me about them, right? Because after so much time, we can think that no one wants to hear about my grief anymore. No one wants to hear me to keep talking about this person, keep talking about other things that have happened. So again, I'm going to internalize that to, I need to handle it myself, right? Because so much time has gone by, I can't speak about it. And that's the same for kids, right? Especially as they get older, their development changes, they recognize the grief and the loss maybe a bit more. They may get this perception, well, it was a long time ago, right? And so who am I going to continue to have these conversations with? And maybe I don't need to have that. So and that's some of that stuff comes with training, comes with, again, here's your toolbox, here's the fancy things you can do. And part of it really is, are you ready to have that conversation? Knowing that it can bring up your own stuff, and have you addressed your own stuff first? Because if you haven't, then it's going to make things a little more challenging to address it with students.
Thank you so much. You just touched on so many different aspects of the work that we're talking about with children in schools. And I was struck by something that you said earlier about how children are sort of our invisible grievers, that we don't necessarily recognize grief in children. And Polly also mentioned, when somebody who doesn't look like us is grieving and that grief looks differently, it's sometimes very difficult for us to understand. So I appreciate you. Did you want to add to that?
Yeah, I think, you hit it right spot on of when we're trying to figure out if a student is grieving, or maybe we don't even know that they have experienced any type of losses until well after, you know, I was the griever that did really well in school, right? Tried to stay out of trouble, tried to maintain friendships, do well with grades. So then, you know, people thought that I had moved on from my grief, right? Or I was totally fine, when that was far from the truth. And so I also try to remind colleagues when I go into schools, when I'm working with anyone, if like, just don't look for the students that maybe, or the youth that are maybe causing problems, right? And that's its own thing, right? Because we think that they're causing problems when really they're grieving, right? And we need to recognize that first. But also be mindful of the children and adolescents that seem to be doing really well, right? And smile all the time and are great. And, you know, we think that, oh, okay, they're handling this well. They deserve just as much attention as anyone else.
You know, building
thank-
on that point that, oh, I'm sorry.
No, please go ahead.
I was just going to say briefly that Dr. Blueford, you know, raises a really good point. And I think this is, you know, potentially an action step for our audience. And that is to really focus on assessment, right? You have to ask the question. And that's what I know for sure with kids and adolescents, is if you don't ask, they're not going to just volunteer it. They're not going to tell you, you know, they're suicidal. They're not going to tell you that this, you know, that they're still dealing with the grief, something that may have happened 5, 10. I mean, it might have even happened before they were in your building even. So I just think Dr. Blueford raises a really good point, and I would encourage us to think about that as a potential action step. Dr. Kaplow had mentioned training opportunities yesterday that her institute is providing. I know that they provide assessment measures that they will support you in and train you on. And so it is important to do that assessment and ask those questions, because the kids themselves don't know it's grief reactions. They don't know. And so I just wanted to highlight that point and share that as a learning opportunity for individuals to be able to follow up on in the schools.
Yeah, thank you so much. And I know Rozlyn had mentioned the key piece of assessment previously, but Rozlyn, did you want to add something to that?
Yeah, I just want to echo what my co-panelist is saying. Dr. Blueford earlier was talking about the importance of normalizing grief and the topic of grief. And I think it's really important for us to focus on knowing that there are things that we can do, even not targeting just the grief community, but also just overall how we as a community, as a school, react to grief and react to those who are grieving. I also want to kind of jump on what Dr. Gipson was saying about screening and assessment. I think that there's definitely a need for assessment for exposure, right, to trauma and loss. And then also, like what Dr. Gipson was saying, that assessment for the traumatic and grief reactions, and really go back to the basics and thinking about whether we are asking about losses during the assessment process, or as a school staff, are we asking about their losses maybe when we were first introduced to a student? During the pandemic, are we afraid to ask the questions how they might have been impacted by COVID, or about whether they have someone close to them died, or even are we afraid to ask about their experiences of racial trauma and losses? And Megan Levine actually yesterday spoke about how our attitude as practitioners, when we talk about grief, really makes a difference. And by not being afraid to ask about it, I think we normalize and validate that experience. And in our work in the field, a lot of times we do see our caregivers just not knowing what to do. They don't know what to say. And what we've seen is that sometimes they don't know how to grieve themselves, and so they cannot tolerate their kids grieving, and it becomes very difficult. They don't know what to say to their kids, and then also too, sometimes they ended up pushing a caregiver as sort of like a replacement onto the child, and I think it takes a lot of rethinking for us to think about how to just normalize the process, how to change the culture about talking about grief and loss is not a scary thing. As one of my colleagues would say, she said, like, the D word's not a bad word, like death is not a bad word, the L word's not a bad word, loss is not a bad word. So I think I just want to kind of echo what our co-panelist was saying earlier.
Thank you so much for adding that. And I think it really speaks to, Jillian, what you brought up about bringing our whole selves into this work, and that if you are trying to do any of this work without acknowledging your own loss and grief, I can't remember how you phrased it, but you're going to run up against some trouble. But helping families and children with loss and grief starts with having a better understanding and expanding our own capacity for it as well, which does also get to that sort of secondary trauma that teachers and many of our school staff are experiencing. I'd love to know, and you touched on this a little bit in what you just spoke on, but what do we not know? What information are we missing as we are thinking about training our school-based mental health staff, our educators, our child serving supports?
I'm going to offer a different way for us maybe to think about this, and that's this notion of community engagement. So I think, I would not be able to speak adequately and sufficiently to what you, the listener, doesn't know about your community. Instead, what I would invite you to do is to engage with your community or the community that you serve, to elicit and learn from them what you don't know. And doesn't mean that we can't use the literature as a guide, because absolutely we can. But I think a really important piece, and Dr. Blueford had, I know she rattled them off, but she, talked about culture, context, religiosity, spirituality, rituals. I mean, she just laid it all out. And in order to have an understanding of relevance of those components in your communities, they need to be engaged. So that's what I would offer.
Thank you. That's such a key component, is centering the lived experience, the needs, the histories and cultures of our groups with whom we're working. So thank you for that reminder. That's so important. Other thoughts?
Yeah, I would agree that it's, all of the great articles and books and classes and all the things we can take, like the youth that we're serving, like they're not in those spaces, right? So we can have a textbook of how we think of how an interaction is going to go, and then we actually meet the students, right? We actually work with the children and adolescents and engage with their systems and learn something incredibly new. But in addition to that, I do think that there are just understanding in general what can be the differences between how children and adolescents grieve compared to adults, and just be mindful of, just because you see a student playing with friends and laughing doesn't mean that the grief isn't there, right? And that it won't change and evolve as they, just develop physically, socially, emotionally, cognitively, and the grief, it just becomes who they are. There's, I'm sure it's may have been mentioned in other panels or other conversations of this phenomenon of like re-grief, right? And so if a child experiences a loss at a young age, and then as they go through developmental stages, how does that grief reappear in their life? And again, they may not even be able to like name that, right? And as the person working with that individual, if you didn't know that they had a loss, 10 years ago, you're going to be wondering, this is random, this is out of the blue, when it's, it may not be, right? And so really trying to, again, to what's been mentioned, assessing for that just as much as we are assessing for suicidal ideation and support systems and all these things. Grief plays a big role in that. How I try to have a trauma-informed approach is just by the assumption that everyone that I meet is going to potentially have had some traumatic experience in their life, right? And I don't have to wait until I hear about that to then alter how I approach. And that's the same how I view grief, right? I'm going to assume that every kid has had experience with some type of loss and just approach them with that mentality, right? Rather than waiting for them to reveal something or share something with me. And while that's helpful, right, I don't want to wait to change my therapeutic approaches until then. So I think part of that can be missing. And just in general, there are a lot of great grief models and theories that can help conceptualize how we grieve for children, their families, adults, that sometimes can be missing from training, that really kind of talk about grief, again, more of a meaning-making approach. How do we continue those relationships rather than, here's a linear approach or we have to eventually stop grieving one day, right? Like, we know that that's pretty impossible, but rather how do we have this become who we are now, right? And how does that impact us going forward?
Yeah, thank you so much for that. And it strikes me as you're talking, much of what we are doing yesterday and today and back in 2020 is learning to put language to grief and learning to understand it better as adults. And then we often expect children to understand, be able to recognize their emotions, their own grief, and be able to articulate it when we all are on that journey together. So thank you for your thoughts about that. Rozlyn, do you have any thoughts about what we're missing?
I think definitely what Dr. Blueford was talking about, as she was talking about it, I'm kind of envisioning this marriage, right? With some knowledge we need to be able to know and recognize, we need to be able to really learn these developmental markings of what grief looks like. But on the other hand, it's almost like, how do we develop ourselves as the person, and how do we really learn about being there? And when we think about what we know and what we not know, I think there is a lot that we have already known, and many of our great co-panelists, and also yesterday too, they're doing such great work out there, and I think there's a lot to be learned. But I also know that actually Rosenblatt from the University of Minnesota described how the knowledge that we have about grief, and I quote, is as best about likelihood and possibilities. And he talked about the need to be open to the realities, as my co-panelists have talked about, is how do we see it as experienced by the grievers? And there's always so much going on with those who are grieving, and we may really never know, and they may not be able to articulate well, and we may not really understand that, but that shouldn't immobilize us, right, from being able to ask, from being able to learn about that, from being able to really think through how to be there, to be empathizing and listening. Kind of going back to what Dr. Gipson was saying earlier too, about really caring for the providers, right? Caring for the carers. I think that's definitely something that is missing. I was actually very excited to hear Dr. Gipson talking about what their team was realizing and noticing, because not a lot of evidence-based practices have embedded into the program something to focus on the providers. I mean, risking connections, one of them, but there's not a lot of those that kind of bring us there. And so by asking the question, what do they need, or what do we need as a community providing that grief support? I think it's helpful. How do we help someone be with somebody? Will we be able to what kind of things can we do to sort of let that reflective capacity emerge, so that those that are going to be working with the student be able to sit with and then listen to all the experiences and what they have to tell us about their grief and loss. So.
Thank you so much, Rozlyn. I want to, that is a perfect segue into our next question before we move to some of the great questions from our audience. But what examples would you like to share, or do you feel is important to share about those kinds of partnerships or programs that could be helpful to folks in terms of developing their own or deepening their own training and understanding, but also sharing with larger staff or family groups? Anybody can start. Or is it too big of a question?
Actually, will you repeat the question? I'm sorry.
Sure. Do you have any examples of ways to engage school, community, family partnerships together, or examples of programs that help deepen the skills and the knowledge within school communities to do that work concerning grief?
A couple ideas that come to my mind. So first, local in the Denver area, there's Judy's House for grieving children and families that provides local services, but also does a lot of really great research, and has a lot of data about just the prevalence of childhood grief for each state. That can be really helpful, along with resources and trainings as well. But I think the way that I got into grief work, and what I always think about when I go into different cities, are where are the local hospice centers? Because oftentimes there are bereavement centers that are open to the community, not just those who are patients. That can be helpful. They also go into schools, can be supportive in that way. I always try to encourage even my own students, I don't expect you to graduate from this program and know everything about grief and loss and solve every issue, but I do expect you to know who's in your community, whether that is, other school counselors, whether that can be mental health counselors, other community organizations, and connect, right? If you don't know something, someone else may, that can also support, right? Because that can be a really big piece. So looking for those community organizations that typically provide services to children and also to their families. A big piece can be the adults in their life. They're also trying to figure out how their child is grieving and how they can best support. Are some really good partnerships that I see. And I know prior to COVID, depending on the school district, depending on the area, more schools can be open to having outside, community partners come into schools, and whether that's do presentations or work with children individually. I know COVID kind of put a lot of that stuff on pause, but I hope that we can create that system of support and really advocate to bring in those that, this is their work, and this is how they can also support us without putting so much pressure on just school staff that are already trying to do a lot already.
Yeah, and
Thank you
just
so
building
much.
upon, oh,
Sure, go ahead, I'm sorry.
no, I was just going to say, building upon Dr. Blueford's excellent point, our program was also a multi-tiered intervention called Promise, and we were focused on trauma and grief. And we had a community advisory board. And so I would recommend what I was saying earlier about community engagement and understanding, who are the healers and helpers for grief in the community that you're serving. And those individuals need to be engaged and be at the table. Like I was saying, I hope as a mental health provider that I have a seat, but I also want to be respectful. So like in the community that I was in, like the bishop had a seat, you have different people in the community. You have certain people who were identified as like healers, and they have to have a seat. So it's recognizing, especially in schools, who else needs to have a seat? Who are the helpers and healers for your school community?
Thank you for both of you for bringing home the point of how important it is to understand the community and what resources and ways of seeing grief and metabolizing and honoring grief are already existing in your communities. We just have a couple of minutes, and I did want to shift to some of the questions from our audience. We've gotten several questions about how do you reach students or young people who are resistant to help and grief support? So being stuck between wanting to respect a child's autonomy and pace and development, while also wanting to be able to engage a child who may be resistant, or thoughts about that?
I really think the ability to be able to talk about our grief and our loss comes from a sense of safety and predictability. And so a part of me really feels like in those cases, it's important to be able to start by being there and start by just being consistent. I think that that's something that can be very helpful for someone that is experiencing grief and has experienced a loss, because it feels like the world is really out of control. So I can really see how they may not be very willing to talk about it. So definitely being able to make yourself available, and then also to be consistent. I also think that one of the most important things is definitely to be able to model the fact that this is not a scary thing to talk about, because we know with grief, as grief reactions and traumatic reactions, there's definitely that avoidance, right? So because we know and we see that avoidance, and to be able to work with that avoidance, I think the very first big step is to be able to say and show that I'm not afraid to hear about it, and I'm not afraid to be able to talk about this. And this may take a little bit of time, but I really think by doing those two things are the good beginning steps.
And what I would add to that is just a possible way to kind of reframe that. I was actually just sharing with someone earlier today that for me, you know, as a Black person in America, resistance is that's like a trauma reminder for me. And I was explaining to them, you know, I come from the South, and where I come from, and thinking about my ancestors and where they came from in terms of slavery, the message there was to agitate. So I just offer that to say, let's maybe pivot and not view it as resistance. Let's pivot and view it as, and Rozlyn spoke to this, maybe the child is telling you it's not safe. Have some wonderment about that. Oh, okay. So I have to meet you where you're at. You're telling me maybe the way I'm engaging or my approach. And it's not that I'm saying that the individual needs to work and try harder, so don't misunderstand me. But what I'm saying is we need to try to understand our communities and the individuals that we're engaged with, for there to be, especially in the school setting, because in some families, you're taught not to tell the school anything. You know, I know we're running out of time, but you got to understand the history, right? So maybe there's someone in the neighborhood and somebody told something at school and CPS came to their house and that kid was taken out. You know, we have to understand why people behave and engage or disengage. What is the history behind that? What is the culture behind that? And then what can I do or my system do to not just come in and just change it, but to respect it and learn how to work within it. So I hope I'm making sense, because I feel like there's a lot of things I'm trying to say and I don't have the time to say them. But the key point I'm making is to reframe. When a child is not engaging with you, maybe think of it as it's not safe from their perspective to do so, and try to get to the why.
Thank you so much. That's such a powerful point. Jillian, would you like to close us out with final thoughts?
Yeah, I totally agree that it's reframing from resistance to just not ready yet. And maybe they won't be ready with you, right? Again, who else is in their system that they can connect with, right? Maybe that's someone that looks like them, right? Or has similar identities to them, right? And don't think of it as a failure, right? On your end, right? Grief is a lifelong process. So we got to also rethink of what are our goals when we're working with someone who is grieving, right? I mean, it's not going to be, you know, by 3 months we're here, 6 months we're here. I want to see these progress steps. That's impossible, right? Especially for children and adolescents. So how do we reframe that? I will meet you where you are, and we can talk about it, we can acknowledge, right? There's some type of barrier, right? And let's have that conversation, and maybe that can resolve other things. But how do we just sit with, I love what Dr. Gipson said, of just reframing that it's not quite resistance. It's just I'm not here, I'm not ready yet to talk about this. And it may not be with you, it may not be for the situation, whatever it may be, but I'm just not ready yet.
Thank you, all three of you. I know we didn't get to all the audience questions, and I feel like I could talk to you for several more hours about this. I just want to give you such a heartfelt thank you for sharing your experience, strength, hope, research, work with us today. It's been such a powerful way to kick off this day thinking about our children and families within schools and how we can better support them and ourselves during that process. If we didn't get a chance to answer your question, I believe that we might be able to address it in our follow-up materials. But I just would love for everybody to take a moment to put in the chat box to everyone a takeaway, a gratitude, something that you learned, something that touched you in our discussion this morning. So if you could put that in the chat, that would be great. And I just want to say how grateful I am as a parent, as an educator, somebody working in school mental health spaces, that the three of you are doing such important, deep, soulful work. And I have come away from this discussion with you feeling much more hopeful about the work being done to support our children. So I just, from the bottom of my heart, bless you for the work that you're doing, and thank you for letting me be with you here this morning. So now we welcome you as you are putting your thoughts and ideas in the chat. We welcome you to take a 10-minute break as we transition to our next session, which is on new directions. So thank you very much.